Hi guys, welcome back to my channel. Today I'm going to talk to you about my first experience of being a student nurse and first experience of being a fully qualified adult nurse in the UK. So let's go. Let's start straight ahead with being a student nurse. Before you go to placement, you get around 13 weeks of lectures in university. So they really prepare you for going out on placement. My first placement was an acute medical ward, which I was really excited about, nervous as well. So I was an 18-year-old boy. I wouldn't really say I was a man yet there, but I was an 18-year-old boy, straight from school, went in, and the first day of placement, I was very, very nervous. Hadn't actually experienced care before yet. I had like a week's experience beforehand, but nothing like nursing care or anything. So it was quite daunting. I took handovers straight away from the rest of the nurses, and I did feel a bit out of place, but that's because I didn't know what was going on. However, there were very helpful nurses there, and I think my advice to you, if you were starting your first placement as a student nurse, would be just to really get in there, get stuck in there, and start speaking to everyone, patients and staff, because that's what I found I didn't do as much. I felt like my experience was I was quite kind of in the corner and didn't really actively go out there, but that wasn't because I didn't want to, that was because I was scared. So I remember even stuff like, so before you attend to patients and say you're washing them or doing a leg dressing or they're an infectious patient, you need to put on a gown and gloves. Even stuff like that, I couldn't even figure out how to put the gown on. But if you are in that position like I was, I just want to say it does get better, obviously. So basically to sum up, my experience was I was quite nervous, but you've got to push yourself. After a few weeks in my experience on the medical ward, I really pushed myself to go out there to learn, learn the basics of nursing, which I did in the end, and really felt confident by the end of the placement because I knew the team well, the team knew me well, therefore there was no communication barrier. I then got invited to staff nights out because I was that friendly with them. So that's really my advice: get stuck in there, and then you have a better placement, you learn more, and you get on better with the team. So let's talk about my experience as a fully qualified adult nurse. So when I qualified, I took the option to go to London at one of the biggest hospitals in the UK. This is something that really interested me because I was 21 years old, really excited to start my career, but also really excited to explore the world. Explore the world. So there I was. I shared a house with 2 nurses and 2 doctors. That was really, really good because if you've had a tough day, I think we would have all experienced the same thing. So they were always there to, you can have a drink with them and just talk about anything that's on your mind. But my very first day, I went in, got shown around the ward, met my team, and I put on my uniform. Now, as soon as you put on your uniform, it does get a little bit scary because now you know this is what you've trained for and this is what you're gonna be doing, and all the questions you will be asked because they're your patients. So on my first day, I was you normally get around 2 weeks supernumerary period. So that's basically to see how you're doing and if you have any questions, and the management can also monitor you as well because obviously they're all there to help you. So my first experience, I was supernumerary, had my team of patients. I think I had about 6 patients. It was a stroke ward. So I really kind of just got stuck in there. I had another nurse with me. The first thing we did was medication round, which was exciting, giving out patients drugs, knowing that when I'm giving them, I am responsible. And I had that nurse there with me, but she was going to be gone in 2 weeks. So it's quite nice knowing that these are my patients, I'm accountable for what I'm giving. It's kind of up to me and me to escalate any concerns. I did have a patient who was quite unwell, which I did escalate on my own accord to doctors. That You do get nervous the first time you do it, but again, once you do something more and more, you then get used to it and feel comfortable. Because like, it was even something silly, like I was scared to bleep a doctor. It wasn't so much scared, but you've never done it before. So, I mean, I think I was quite right to kind of be a little bit scared, but once you did it a few times, it's fine. What else? I got introduced to the doctors. Doctors are really nice on your first day. I think whenever you need something, they're always there. There's also, especially in straight wards, physiotherapy and occupational therapy, who again, you know, they're kind of like, they're your colleagues, but they're always there if you need support with anything. It's about knowing what you can use them with. For example, if you have a patient really deteriorating, and say it's something to do with their chest and they're not breathing properly, I would always go straight to the physiotherapists and also the doctor, but physiotherapists can sometimes do chest physio, and that can normally help with secretions and basically help the situation quite a lot. Yeah, so carrying on with my first day, I then helped with a few patient washes, which was really good, getting to know the patients in the morning. And then it was also getting to know the layout of the ward. I think that's very important on your first day, making sure you know exactly where everything is. So I made sure I was quite orientated. Whenever we needed something in our team, I made sure I went to get it, because that's, when you're on your own, that's what you need to know. Again, with the uniform, since you've got the uniform on, people are coming to you, ask questions. So, you know, for example, a dietitian asked me on my very first day about how much a patient is eating and drinking, whether we feel that they prescribe some Fortisip juice, which is essentially, it replaces a meal, and you get the same amount of nutrition in this kind of, it's like a milkshake type substance. She was asking me, you know, how many have they had? Is it working? Which I was a bit fumbly at the beginning, because I'd never been asked that. But then I got, you know, I answered her after research, well, not researching, but looking in the patient's notes, but also making sure that, because you're that accountable nurse, even stuff like fluid balance, when you have an acutely ill patient, that's stuff you need to keep focused on. You know, how much urine's coming out, but how much you're putting in. Just really, I think that was it on my first day, really learning the core principles of nursing, what you really need to be doing, which was really exciting. And then after the first shift or two, I started, you know, making friends with the team. I remember on the first day I had another colleague, it was his first day as well, and then we just said, you know, let's go to the pub after. So we went to the pub, had a few drinks, and, you know, just talked about what we're enjoying, what's gone wrong. I cannot stress enough, making friends in your work environment, especially in nursing, is very important, because, you know, it helps you once you make connections. It helps you, you know, do your job, essentially, do your job well. So yeah, that's my experience. If you guys have any questions, please leave them in the comments below. I'd love to answer them. And please give my video a like. Thank you. See you in the next video.